Welcome to the GVK EMRI Trauma Refresher course. This is a lecture on burn management. In India, over 1 million people are moderately or severely burned every year. That means you are likely to see multiple burn patients each year. As in every trauma case, preparation is key. Prepare your equipment, communicate with your pilot, and review the protocol book before you arrive. Patient is counting on you. Then ensure that the scene is safe and place your personal protective equipment. Never go into a building that is on fire. Turn off gas lines or open flames. Ask for help from local officials, and if multiple patients are injured, call for backup. Now you're ready to approach each patient with the primary survey, GRCABC. Before we move on, what are the 4 causes of burns? Write your answers down in your workbooks. There are thermal burns, chemical burns, electrical burns, and radiation exposure burns. Thermal burns are the most common. Let's now talk about the primary survey for burns. First, carefully assess the airway. Singed facial hair, black sputum, lip swelling, stridor, or difficulty breathing may all be signs of airway problems. With airway, you must remember to immobilize the cervical spine, since burn patients are also trauma patients. Perform basic airway maneuvers, suction, and OPA placement as needed for airway problems. Also, breathing may be affected by airway damage or smoke inhalation. Provide supplemental oxygen of 15 liters per minute by face mask to all burn patients. If not breathing or unconscious, provide bag valve mask ventilation. Assess circulation with pulse and capillary refill. Burns cause fluid loss and require significant fluid administration. For severe burns, 2 large intravenous lines should be placed and normal saline started. Next, electrical burns may be associated with cardiac arrhythmias. If the patient struck by electricity becomes pulseless, they may be in an arrhythmia requiring defibrillation. As in all pulseless patients, start CPR and attach the AED immediately. After ABCs, you must check the vital signs. If the patient is unconscious, confused, or even a little altered, be sure to check the blood glucose. Then remove burning clothing, unless it is stuck to the patient, and cover them with a clean blanket to prevent heat loss. Then you can move on to the secondary survey with sample history and a head-to-toe examination. Now let's talk about smoke inhalation injuries. Smoke inhalation can cause physical damage to the airway or problems with ventilation for patients stuck in enclosed spaces. What are some toxins that are present in smoke inhalation fire accidents? The most common are carbon monoxide and cyanide poisoning. First, let's talk about carbon monoxide poisoning. You should think about this condition in all burn patients. Patients may have confusion, headache, vomiting, or even coma. Remember that the pulse oximeter is inaccurate in carbon monoxide poisoning, and treatment should include oxygen 15 liters per minute by face mask, even if the oxygen saturation is normal. Cyanide poisoning should also be considered in patients exposed to burning plastics. They may have confusion, coma, seizure, and shortness of breath. If these symptoms are present, contact the ERCP and start treatment immediately. What is the treatment for cyanide poisoning? The treatment for cyanide poisoning is cyanoKit with hydroxycobalamin. The dose is 70 milligrams per kilograms IV over 15 minutes. Also give sodium thiosulfate, 25%, 50 milliliters by IV over 10 minutes. Let's talk about fluids. What system do we use to calculate the total body surface area burned? If you said the rule of nines, you're correct. Partial thickness and full thickness burns are used to calculate the total body surface area burned. Notice that the head counts for 9%, the torso for 18%. In children, the calculations are a little bit different. Burns greater than 30% of the body are considered severe and require 2 large IVs and IV fluids. Let's practice. How much total body surface area is burned in a patient with chest and left lower extremity burns? If you said 18%, then you're right. What are the 3 categories of burns? Superficial burns only affect the epidermis and the skin is red and painful, but does not have blisters. Partial thickness burns are painful and cause blistering. Full thickness burns affect all layers of the skin and are white, brown, or black as the skin is dead. These burns are painless. We will not go into great detail about wound care, but remember to elevate burned extremities. Cover the patient with a clean sheet to prevent heat loss, and apply moist sterile gauze. By being sterile, you can prevent severe infections. Do not break blisters or apply ice directly to the skin, as this can cause hypothermia. In summary, you must approach every burn patient the same way. First, ensure the scene is safe. Next, move on to the primary survey. As in every patient, intervene by simple airway maneuvers, oxygen, and fluids. Treat smoke inhalation and fluid loss, and prevent hypothermia. And this concludes our module on burn management. Congratulations!